Welcome to the Department of Toxic Substances Control SARS-CoV-2 COVID-19 training for reopening the department's offices and laboratories. The name of this disease is Coronavirus Disease 2019, abbreviated as COVID-19. In COVID-19, CO stands for corona, VI for virus, and D for disease. Formerly, this disease was referred to as the 2019 novel coronavirus, or 2019 nCoV. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that had not previously been seen in humans. The name of this disease was selected following the World Health Organization best practice for naming new human infectious diseases. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with the following symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms. The CDC will continue to update this list as they learn more about COVID-19. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or to stay awake, bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. COVID-19 is thought to spread mainly through close contact from person to person. Some people without symptoms may be able to spread the virus. We are still learning about how the virus spreads and the severity of illness it causes. The best way to prevent illness is to avoid being exposed to the virus. You can take steps to slow the spread. Stay home if you are sick. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Wash your hands often with soap and water. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Maintain good social distance of about 6 feet. This is very important to prevent the spread of COVID-19. Cover your mouth and nose with a cloth face covering when around others. If you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Avoid touching your face and face covering unless you have just washed your hands. Avoid sharing personal items with others. If items must be shared, be sure to wash your hands after handling these items. Routinely clean and disinfect frequently touched surfaces. Recent epidemiologic, virologic, and modeling reports support the possibility of SARS-CoV-2 transmission from persons who are pre-symptomatic, that is, SARS-CoV-2 has been detected but before symptom onset, or asymptomatic. That is, SARS-CoV-2 has been detected, but symptoms never develop. SARS-CoV-2 transmission in the absence of symptoms reinforces the value of measures that prevent the spread of SARS-CoV-2 by infected persons who may not exhibit illness despite being infectious. An infected person can spread SARS-CoV-2 to others even if they are not sick. Based on what we now know, those at high risk for severe illness from COVID-19 are people 65 years and older and people who live in a nursing home or long-term care facility. People of all ages with underlying medical conditions, particularly if not well controlled, are also at high risk for severe illness from COVID-19. These people include people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people with severe obesity or body mass index of 40 or higher, people with diabetes, people with chronic kidney disease undergoing dialysis, people with liver disease, and people who are immunocompromised. Many conditions can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune-weakening medications. The department's headquarters, regional offices, field offices, and environmental chemistry laboratories each have their own COVID-19 prevention plan. The COVID-19 prevention plan establishes and explains the necessary policies, practices, and conditions necessary to meet the Centers for Disease Control and Prevention and California Department of Public Health guidelines for COVID-19, as well as Federal Occupational Safety and Health Administration and California Department of Occupational Safety and Health standards and guidance related to worker exposure to COVID-19. Additionally, each DTSC office and laboratory will follow any existing public health orders from the local government agency. For example, the Berkeley office and Berkeley Environmental Chemistry Laboratory will also follow the Berkeley Public Health Division's health officer orders for shelter-in-place and mandatory face coverings. These local health orders frequently change, and the situation for each office is continuously evolving. DTSC employees shall self-monitor for signs and symptoms of COVID-19 daily before going into the office or laboratory. If a thermometer is available, employees should check their temperature at home and stay home if the temperature is 100.4 degrees Fahrenheit or higher. Also, employees shall perform a symptom check using the latest available CDC guidelines before going into the office or laboratory. These symptoms may include cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, and new loss of taste or smell. To support sick employees, the department has implemented leave policies that promote workers staying at home when they are sick, when household members are sick, or when required by a health care provider to isolate or quarantine themselves or a member of their household. Additionally, accommodations for workers with underlying medical conditions or who have household members with underlying medical conditions have been implemented. Please talk to your supervisor to learn more about these policies. To reduce transmission of SARS-CoV-2, DTSC recommends sick employees to stay home. Employees who have symptoms should stay home. These symptoms include fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of smell or taste. Sick employees should follow CDC recommended steps. Employees should not return to work until the criteria to discontinue home quarantine or isolation are met, in consultation with their healthcare provider. Employees who are well but who have a sick family member at home with COVID-19 should follow CDC recommended precautions to self-isolate. DTSC employees should seek medical attention if symptoms become severe. A person may have mild symptoms for about 1 week, then worsen rapidly. Let your doctor know if your symptoms quickly worsen over a short period of time. Also, call the doctor right away if you or a loved one with COVID-19 experience any of the following emergency symptoms: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Wash your hands often with soap and water for at least 20 seconds frequently throughout the workday, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% ethanol or 70% isopropanol. If using hand sanitizer, cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Put distance between yourself and co-workers when at the office, laboratory, or during field work. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, or about 2 arms lengths, from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Continue to keep about 6 feet between yourself and others. A cloth face covering is not a substitute for social distancing. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you do not feel sick. Face coverings can help protect people near the wearer, but do not replace the need for physical distancing and frequent hand washing. Cloth face covers are not protective equipment and do not protect the person wearing a cloth face cover from SARS-CoV-2. Everyone should wear a cloth face cover when they have to go out in public, for example, public meetings or fieldwork. Cloth face coverings should not be placed on anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Do not use a face mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others when wearing a cloth face covering. The cloth face cover is not a substitute for social distancing. Wash and sanitize your hands before and after using a cloth face covering. Cloth face coverings should be washed after each shift. If you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues into the trash. If you do not have a tissue, cough or sneeze into your elbow, not your hands. Immediately wash your hands with soap and water for at least 20 seconds after coughing or sneezing. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% ethanol or 70% isopropanol. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use an EPA-registered disinfectant. Please keep in mind that some cleaning chemicals can be hazardous, causing problems ranging from skin rashes and burns to coughing and asthma. To properly sanitize frequently touched surfaces, wear disposable gloves to clean and disinfect. Clean surfaces using soap and water, then use a disinfectant. Practice routine cleaning of frequently touched surfaces. Follow the instructions on the label of disinfectants to ensure safe and effective use of the product. Effective April 1, 2020, the federal government enacted the Families First Coronavirus Response Act, or FFCRA, which includes the Emergency Family and Medical Leave Expansion Act, or EFMLA. EFMLA requires certain employers to provide employees who have worked for the employer for 30 days with up to 12 work weeks of paid FMLA leave for specified reasons related to COVID-19. If you have any questions about this or other COVID-19 related benefits, please contact your supervisor or the DTSC COVID-19 recovery team. Each DTSC office and laboratory falls under the jurisdiction of a local public health agency. These local governmental agencies may be at the county or city level. For example, the department's headquarters and Sacramento Regional Office fall under the Sacramento County Public Health Order, whereas the Pasadena Environmental Chemistry Laboratory falls under the City of Pasadena Public Health Department's COVID-19 health orders. This distinction between the city or county level usually depends on whether the city has its own public health department or falls outside the jurisdiction of the county's public health department. Some DTSC offices and laboratories may have stricter public health orders than others due to these different jurisdictions and local public health agencies. If there are any questions or concerns related to SARS-CoV-2 and COVID-19, please contact your supervisor or the DTSC COVID-19 recovery team.